left part of the pleura, part of the right lung. That's one of the lung. The apex of the right lung is usually smaller than that of the left lung. Relations of the apex of the lung. Superiorly, we have the suprapleural membrane. And then posteriorly, you have the sympathetic trunk, first thoracic nerve, vessels of the first intercostal space. Anteriorly, you have the sternocleidomastoid. Sternocleidomastoid muscle is the muscle that usually attaches when you hold the front part of your neck between the jugular notch, the sternal notch. On either sides, there are usually very strong muscles here. That's what we call sternocleidomastoid. It shows you it arises from the sternum. Cleido is the clavicle, and the mastoid, it inserts on the mastoid bone of your neck. And then we have the scalenus anterior muscle and the subclavian blood vessels. Those are what is associated with the apex of the lung. The costal surface is usually convex, joins the medial surface at the anterior and posterior borders, and the base at the inferior surface. And it has costal impression. Costal impression, it means, as I said the other day, one thing you need to understand about the body is about physics. So as your lungs expand and contract during breathing in and breathing out, you'll find that your lungs are on the lateral aspect, borders the ribs. So the ribs will continue forming depressions or impressions, and those impressions is what we call the costal impressions. Just like when a blood vessel crosses over a bone, over time, there will be a groove on that bone where the blood vessel usually crosses. We usually call it hydraulic effect or something like that in physics. For those of you who did physics, there was something about liquids and motion and how they shape the body. And that's why when you look at your bones in the body, depending on the weight or the structures next to it, it will tell you about how that body how the bone is remodeled. Like, for example, on your tibia, on the anterior aspect is very strong. It's because when you stand, the weight bearing is transmitted through that line. So what happens is that the bone, the osteoblast will deposit more bone tissue on that area so that it can bear the weight. The medial surface, again, this is the mediastinal part. We have the vertebral, which is next to the vertebral column. And then we have the mediastinal surfaces. The vertebral part is applied to the sides of the vertebral bodies, while the mediastinal surface is related to the superior, middle, and posterior mediastinum. The surface presents with a hilum and numerous impressions of mediastinal structures. So when somebody gives you a lung, just look at where the hilum is, and then you point the hilum medially, and then the base inferiorly, and you'll be able to tell whether the lung is the left one or the right one. And then again, the presence of two fissures signals the right lung, while only one fissure signals the left lung. Again, the other difference is that the apex of the left lung is usually bigger than compared to the right lung. Then we have the diaphragmatic surface, which is concave and corresponds to the dome of the diaphragm, usually deeper on the right side than on the left side. Again, another difference between the left side of the lung and the right side is that on the right side, the diaphragmatic surface of the right lung is usually deeper than the left because of the presence of the liver on the right side. The fissures oblique usually begins on a higher level on the left. Again, another difference between the left lung and the right lung is that the oblique fissure of the right lung begins on a higher level on the left compared to the right. And then when you look at it from the costal surface in the living, the fissure corresponds to the sixth rib. So when you look at your sixth rib, that's where your oblique fissure is. And when you raise the arm above your head, it corresponds to the medial border of the scapula. We have the horizontal fissure only present on the right lung, begins at the oblique fissure at the mid-axillary line and proceeds forward to join the anterior border of the left, anterior border at the level of the fourth costal cartilage. Again, the difference between the right and the left lung is that the right has two fissures while the left has only one fissure. Now, let's look at the root of the lung, which is usually formed by structure leaving or entering the lung at the high lung. The structures include the bronchi, the pulmonary vessels, the nerves, bronchial vessels, lymphatic vessels, and lymph nodes. This root is usually involved in pleura, which is prolonged below as the pulmonary ligament. Remember, it is at the root that the visceral and the parietal pleura become continuous with each other, and it hangs down as the pulmonary ligament. Now, what is the arrangement of the structures at the hilum? Because this is very important. The trachea and the main bronchi occupy a plane posterior to that of the heart and the great vessels at the hilum. In general, the order from anterior to posterior is that you will have the vein, you will have the artery, and you will have the bronchus. And usually the artery is slightly above the vein. Now that's how it looks. Now, this is one of the only few diagrams where in the atlas of the human body, where you will see the veins denoted by the red color and the arteries denoted by the blue color. Normally, veins are usually blue while the arteries are red, denoting oxygen and deoxygenated blood. However, you all know that pulmonary veins carry oxygenated blood while pulmonary arteries carry deoxygenated blood. And we have said, when you look at it, the vein is usually inferior or slightly below the artery, and the bronchus is usually the most posterior structure within the hilum. Now, the relations, or remember we have said all these structures are in close contact of each other, which means they will form impressions or depressions on the either side of the lung. And there will be a difference between the left lung and the right lung. Now, the left lung, as general rule, as I told you the other time, is that all arteries within the chest cavity are usually left-sided, while the veins are usually on the right. So when you look at the impression on the mediastinal surface of the lung, left lung, you will have from up there, you will have a place for the esophagus, and then you will have a place for the thoracic duct, and then you will have the left recurrent laryngeal nerve, then you will have a space for the subclavian artery, and then you have a space for the left common carotid artery, and then you'll have the space for the left superior intercostal vein, all of them here. Then you have a place for the arc of the aorta, and next to it you'll have the left vagus nerve. Then we have a place for the descending thoracic aorta, and then at the base, towards the base, you will have a place for the esophagus again. Then you'll have the place for the cardiac notch here. And then we have the left ventricle of the heart and the left phrenic nerve. And then at the hilum, as you can see, the bronchus is the most posterior, the artery being superior and the veins below it anteriorly. On the right side, right lung, as I said, the right lung is usually associated with the veins. So you'll have the place for brachiocephalic veins, superior vena cava, right phrenic nerve, the place for the right atrium. Down here, we have a place for the inferior vena cava, and then you'll have a place for the esophagus, and then you'll have a place for the azygos vein and the arc of the azygos. Up here, you'll have the right vagus, a place for the trachea, and a place for the esophagus. So those are the relations of the mediastinal or the medial aspect of the right and left lung. And those are the impressions. Now, when it comes to practical exam, especially for the dentist, because you will do a practical exam, what usually happens is that we will put a pin in any of these, and then we will ask you, Name the structure associated with the structure marked A. So you need to know the relations or the neighbors of found on the medial aspect of each lung, right and left. But as a general rule, just know that the left lung is associated with the arteries, while the right lung is associated with the veins. Now, bronchopulmonary segments, remember, when we are talking about the trachea, it ended at the level of T4 by bifurcating into primary bronchus. And the primary bronchus went to, we have a left and a right one, going to each lung. And into each lobe is what we call the secondary bronchus, going into each lobe. So there are 2 on the left and 3 on the right. And within each lobe, into each segment, is what we call the tertiary or the third order bronchus. And this is what we call, forms what we call the bronchopulmonary segment, which is the unit of a lung supplied by the third order bronchus. And they are separated by connective tissue, or what we call septa, which is derived from the visceral dura. The segments are named both on the left and the right, and they have various variations. The branches of the pulmonary arteries, this is very important, follow bronchi and therefore tend to correspond to the segment, while the veins do not accompany the bronchi. What is the importance of us knowing the bronchopulmonary segments? One, pulmonary diseases tend to localize in or confine to bronchopulmonary segments. As I said earlier when we were introducing this course, we said that diseases like TB tend to go to the apex of the lungs. So when you take an X-ray, the cavities will be on the apex, while bacterial pneumonia tend to go to the middle lobes or midsection of the lungs, and hypostatic pneumonia, due to being bedridden or being in ICU or immobilized for very long, tend to go to the bases of the lungs. So the diseased segments may be localized by radiography, that's X-ray, or bronchoscopy. And this may help in planning treatment. And for the surgeons, it's very easy for us to remove a segment if it's possible. Like, for example, some people, you might end up, like when women, I see mostly, this one I have seen it practically, not practically, I have seen a patient who presented having swallowed a pin. So we asked her what she was doing before she swallowed that pin. She said she was, the way females hold their hair while putting a pin on their mouth so that they can be able to clip it. Unfortunately, by bad luck, she swallowed that pin, and that pin went all the way to the bronchopulmonary segment. And the only way for us to remove it was to do a thoracotomy, open the sternum, localize where the pin was, and actually remove the entire segment, because it had caused very serious infection inside the lung, and it was all pus. So we had to remove the entire segment. That's now the importance of these bronchopulmonary segments. Those are the segments of the left and the right. One has 10, the other has 9. And those are the ones we are talking about. The left has 9, while the right has 10. Any question before I conclude? Or I conclude before I ask questions? That's the end of cardiorespiratory as far as gross anatomy is concerned. Now you guys are supposed to attend practical sessions where you'll be given dissected bodies right from the head, so that you can see the upper respiratory tract, which we said consisted of the nasal cavity, the paranasal sinuses. We talked about the sinuses, we talked about the pharynx, and we talked about the larynx, and the importance and the function of each one of those, and the boundaries and all those things forming the upper airway. And the reason, and we also talked about the functions of the upper respiratory tract, which included air filtration, air conditioning, the function of smell, speech, and the protection. And the reason is basically because some of the conditions that affect the upper respiratory tract include the respiratory common colds, sinusitis, tonsillitis, pharyngitis, laryngitis, and nasal polyps. That's why you guys were learning, because remember we said the upper airway is one of the critical things that you need to assess when you meet someone. Because if the airway is blocked, everything else will stop within a very short period of time. And then now we have done the lower respiratory tract, which included the trachea. And we say the trachea, the extent from where it came from, how it branches at the level of T4 to various places, and the relations of the trachea. We have talked about the bronchi. We have talked about the bronchioles. You guys will talk about the alveoli and the gaseous exchange that occur there in histology. How does the alveolus exchange gases? And what are the adaptations for you to do that? The functions we said is for gaseous exchange. It also contains cilia, mucus, which is for protection, and it's also for air conduction as it goes through the vocal cords. While we're learning it again, there are certain disorders like pneumonia, bronchitis, asthma, chronic obstructive pulmonary disease, lung cancer, and many other things, trauma, fracture of the ribs and everything else. How do they affect uh, the respiratory or the chest wall? We have talked about it. We have talked about the anatomical basis of the anatomic shunts that you guys are learning in physiology. We have talked about the mechanism of breathing, the anatomical basis on why the bucket handle mechanism and the pump handle mechanism. And then finally, we talked about the mediastinum, which is basically the structures that house your heart, that is involved in circulating your blood across the body. That's basically what cardiorespiratory system as far as gross anatomy is concerned. Any question? I've seen somebody is asking the tricuspid valve area and the intercostal spaces. Now, when you talk about heart sounds corresponds to the opening and the closing of your heart valves. Let me see if I can get the slide. Oh, just, let's go there. I am not sure if I mentioned the sixth intercostal space. However, when you hear these sounds, you can see where you hear the sounds. I think the best one is that one. Yes. When you auscultate, you can see the tricuspid one is here. So you will not hear the sound on the clavicle, it's on the sternum. So you'll hear it in the intercostal space, which is the fourth, which is there. The aortic will be on the second intercostal space on the right side, while the pulmonic will be on the second intercostal space on the left, while the mitral, which is the apex of the heart, will be in the fifth intercostal space. I hope that is clear from the person who asked the question. What is cardiac tamponade? Cardiac tamponade is the condition where between the pericardium, that's pericardial cavity, is full of fluid, which means your heart cannot be able to expand or contract as it beats because there's something within that space. So tamponade means it is restricted by that. Any other question? Now for the class reps, ensure that you go and liaise with the secretary so that we can print the class attendance from Zoom. They will know, you just tell them they will know how to conduct Hillary from the ICT department so that we can have a list of everybody who was in this class. And again, liaise with the chief technician to ensure that you go and see those dissected body once we have the technicians back. Hopefully it will be soon. So next week, if they will be back by then, make arrangements so that you can go and view those dissected specimens. As if there is no other question, it was a pleasure. We'll meet again when we start, I think, the end of this month, when we are doing the GIT system. And as usual, my class, you log in using your two official names and your registration number. Very simple instructions. And in case you have any question, you can reach out to me in my office, or you can drop during the next classes, you can drop a chat. Then I will address the question to the benefit of the entire class. Thus, thank you and have a nice week ahead.